showing you guys how we don PPE. So that's personal protective equipment and how we put it on before we go into a patient's room that is in isolation. So first step, we're going to do hand sanitizer. We're gonna do hand hygiene. So I'll do hand hygiene here. Clean my hands because I'll be going into my patient's room. I wanna make sure it's clean. And then I'll be doing gown first. So that's the first step of donning PPE is you're gonna put your gown on. This can be a disposable gown or a reusable gown depending on your facility. And you'll put it on like opposite of a jacket. And then you'll Velcro in the back. And then normally there'll be strings somewhere which you can put on, you can tie around you. So I've placed my gown on. My next step will be my mask. You want to make sure that when you put your mask on, there's one way that's supposed to go on your face and one way that faces out. Normally, it's going to be the way that's, normally the more colored way is what's going to be facing out. So you're going to put your mask on, loop it around your ears, and then you're going to want to push down the little nose piece. The next step will be eyewear. Eyewear on. And then last but not least, gloves. When you put your gloves on, you want to make sure that the gloves go on the outside of your gown. That is how you don PPE.
Hello, I'm going to show you removing PPE or doffing personal protective equipment. If you have a disposable gown, you can remove the gown and the gloves and throw them both away at the same time. If you have a gown that can be laundered, you'll remove your gloves first. You can do this by grasping the palm of one glove, pulling it off, gathering it in your gloved hand, and then sliding 2 fingers underneath. Next, you can remove your gown. You want to undo the Velcro at the top and gently untie the ties at the waist. And then you can remove the gown by touching the clean portion that is towards your skin. You can reach in the inside this way or come from behind from the waist. You want to gather the gown and make sure you are touching only the inside clean portion before you throw it away. Now, before I reach up and touch by my face, I'm going to wash my hands and do hand hygiene. Okay. Next, I'm going to remove my eyewear. I don't want to touch the front of them, that might be soiled, so I'm going to reach from the sides. Pull it off. Lastly, I'm going to remove my mask. I'm going to pull again from the sides, off my ears, and then I can throw this away as well. Before I leave the patient's room, I'm going to wash my hands one more time.